RebuildTheChain is a fully fledged pandemic management system. It enables people and government authorities to effectively curb the pandemic spread using self-diagnosis, proximity alerts, automatic contact tracing, exposure analysis, quarantine management, resource management, spread analysis, epidemic model management, curfew management, and digital health cards. It also enables governments to facilitate a health card-based access system for citizens and thereby revive the struggling economy and open international borders. Self-diagnosis. Citizens can perform self-diagnosis through the app to identify potential COVID-19 infection. The results will be shared with the local health department to analyze the results to engage with them if necessary. Contact tracing. When a person is tested positive for COVID-19 infection, Bluetooth and GPS proximity data stored in their application can be used to identify the people who have come in close contact with the user as primary and secondary contacts. Exposure analysis. When a person is tested positive, GPS data is analyzed to identify places traveled and determine micro and macro hot zones. This helps alert users on the platform about surface-level exposures in addition to human exposure. This method has been proven to be effective in tackling pandemics like COVID-19, with more than 80% reported cases being asymptomatic. Proximity threat alerts. When a user comes near someone who is infected or is at high risk of being infected, the user is alerted. It also alerts when the user is near a hot zone. Quarantine management. From the dashboard, the authorities can see the statuses of people under quarantine. If a person under quarantine moves out of the quarantine location, authorities would receive instant alerts to engage the situation. Pandemic Proof Passport. Pandemic Proof Passport is a secure health card for users, representing their certified health status from the health authority. Airports, shopping malls, other public and private facilities can grant access to citizens who have a no-risk health card and deny access to people with high-risk health cards. Resource management. Based on data analytics, the system forecasts the number of infections in the future. Authorities can use this intel to arrange the required resources to meet the demands of the future.